I'll tell you what, Keith, I'll bet you there's one or two healthcare CEOs listening to this show.
I hope so.
They should, because we're speaking the truth. Hello, amazing people. This is Dove Marcus, director of Healthcare Raw podcast, and I am honored to have an amazing guest on our show today. His name is Keith Carlson. He's a fellow nurse, and he is a thought leader, influencer in healthcare. I'm honored to have you on the show, Keith. Thanks for joining us.
Thanks for having me, Dove. It is a real honor, and you're just awesome, and I'm really excited to connect with you and connect with your audience.
Thank you. Thank you. Keith, why don't you tell us a little bit more about yourself?
Well, I've been a nurse since 1996, 21 years at this juncture, and I've focused my nursing career on home health, hospice, and public health, and case management too, mostly in the inner city when I lived in Western Massachusetts. I've been in Santa Fe, New Mexico since 2010. And since 2010, I have done some nursing out here, all home health. But 6 months ago, in late 2016, I actually left my last clinical nursing job, at least for now, and I'm a completely digital entrepreneur. So at the moment, I do career coaching with nurses around the country, and I'm a podcaster and a public speaker and a writer and a freelance blogger. So it's a different kind of way to approach healthcare and nursing, but it's what I'm doing right now, and it's really fun.
Well, that sounds kind of similar to the path that I'm taking, and I think that's why we get along so well. We kind of seem to have some similar career goals, but also, more importantly, similar outlooks on healthcare.
That's right. Yes, that's so true.
So why don't you tell me a little bit about how you made this leap or this walk or whatever it was from clinical nursing to entrepreneurship?
Well, for me, it was quite a slow progression. When I was still in Massachusetts around 2008, 2009, I was starting to study coaching, life coaching, etc. And I was starting to look at the potential to actually be an entrepreneur. I'd been blogging as a nurse since 2005, but I'd never really thought much about monetizing what I did. I was basically writing for fun, getting paid for an article or blog post here and there. But once my wife and I left Massachusetts, moved to New Mexico, after a long, circuitous 10-month journey across the country, that's another story, I decided that it was time to really ramp up that particular process. So it was a slow runway. I'm not a big risk taker when it comes to big life changes like that. So I decided rather than throw out everything I was doing as a healthcare worker and a nurse and just put everything on my credit card and start a business, I took 6 or 7 years to launch that. So it's been slow, it's been progressive, it's been moderately frustrating and amazingly exciting. So it's been an interesting journey.
Amazing. So you've managed to build an amazing following over the last several years. And so really when I invited you on this show, Keith, and we've spoken before, I'm amazed by what you've done and what you continue to do. I found you on the internet, and I recognized you as a person who has the ability to talk to nurses, to encourage fellow nurses, and to, let's just say, the way I understand it, you can bring people back from the brink of quitting their job or just going into work grumpy. And so the first thing that I really want to know about, if you can sum it up, okay? Like, imagine that I am a nurse who's just frustrated with my job. What kind of a process do you lead me on to try to get me from walking off of that proverbial cliff?
Okay, good question. And thanks for being so perceptive about what my mission is without me having to tell you and your audience outright. So The process really involves what I call holistic career coaching. So yes, I can help you with your resume and your cover letter and create a really cool LinkedIn profile and all those nuts and bolts of a career. So that can be done. And those nuts and bolts are important, but they're not what make up the heart of your career. So what I like to really do first is assess a nurse, assess him or her for what lights them up. Like when they talk about their work, what are the things where their voice drops and their energy drops and it feels like there's nothing there for them, that it's drudgery and robotic nursing. And then I listen for the things where they get really excited and it feels like there's energy behind it and they have passion for what they do and they love what they do. So I listen for those things. And people generally will call me when they're in distress, right? When things are not going well and they really need a change or they're burnt to a crisp. Or I hear from people who are entering the profession and they want to enter on a good foot. They really want to get started right. And I think it's really smart to invest in a tiny bit of coaching so that they can launch their career in a positive way. And if you're spending $20,000 or $30,000 on a program in a nursing school, why not spend less than $1,000 to get yourself really off the ground in a really powerful way? So I watch for the hints. I watch for either the body language or their vocal inflection or just the way they communicate about their career. And then the process is to steer them in the direction of their passion. And if we can steer someone in the direction of their passion and they love what they do and they feel connected with their work, they love their patients or their colleagues, then that's benefiting the healthcare system in a bigger way when you have a happy, healthy nurse out there in the world.
So let's talk a little bit more about that. Okay. Remind me to talk a little bit more about how it relates to patients, because this is the patient-centered podcast. Okay, that's where we're going to go. But before we do that, what are some of the biggest challenges that face nurses personally? What are some of their greatest pain points?
Okay. Some of the pain points have to do with the way they feel they are or aren't valued and respected, either by colleagues or by patients. So that's one. Another one is how many nurses feel that they're not paid in a way that reflects the skill level and the passion and energy they put into their work. So I can understand that fully. There are other issues happening in healthcare. One is, let's say, unsafe staffing. So we have nurse-patient ratios, which some of your listeners who are patients may not know about. Some may know about it. It means how many patients a nurse has to work with at the same time. So in some states, in some hospital systems, there are mandates for how many patients a nurse can actually work with. And in some places, there are no mandates. So they can pile patients on a nurse, and the nurse can be pulling her hair out or his hair out to try to get their things done. And that's what makes nursing more task-based when there's so many patients to take care of and they just can't get to everyone and answer every call bell. So nurse-patient ratios and staffing are big issues.
Big thing.
And another very major issue, which your patients also may not know about, and I'm going to say it here publicly, is bullying in nursing. So you and I both know, I don't know if you've met her yet, Renee Thompson. She lives in Pittsburgh, Pennsylvania.
She's a very busy person. We're going to have her on.
That's great.
We're going to have her on. Renee, you're going to come on this show. We all want to hear from you.
That's right. She's my very dear friend. We met on social media many years ago, and we've met in person many times. And Renee is the national expert on bullying in nursing, and she's helping to eradicate it. And we could spend an entire show talking about why bullying exists, what we also call lateral violence or horizontal violence. And I could go on about that for a long time. I'll leave that to Renee to discuss with you. That's another issue. It's those negative relationships and aberrant behaviors in the healthcare system, often due to the stress of the work, that causes nurses to not necessarily be happy where they are.
I'll tell you what, it's one of those things that we learn early on in our schooling. In nursing school, we learn about all these things. These are fundamentals of our trade. And I find it amazing. And it's one of the things that I talk about. I'm very passionate about fundamentals. You know, for people, and talking directly to my patients now, nursing school is a very interesting thing because, of course, you start with the fundamentals. What is nursing all about? What's the history? What are the challenges facing nursing? And then you start getting into the technicals. You start learning about the body. You start learning about the treatments. You start learning how to do the treatment. So when a patient sees a nurse coming in, you're expecting the nurse to treat you, right? But then there's still all these other things going around. And so for a patient, the person who's on the receiving end, all these things that we're talking about ultimately boils down to the patient. It's a really big thing. And we could segue into this now, Keith. I feel
Sure.
like I know you professionally, but I feel like I know you more personally because I think that in our conversations, we've made it real. We've made it real. So let's just say half of what I do, a large part of what I do on this show, a large part of my mission is to be myself, to be myself. Is this something that you coach your nursing clients to do, to be yourself?
Yeah, it's something we do talk about. It's something that I really value in myself in terms of, for my own practice, what I do as a coach and what I do as a writer and a podcaster when I'm speaking on stage at conferences. It's important for me that when people meet me in person, that I'm exactly what they thought I was because they've already met me online. They've met me in different places. And the best compliment I can receive when I meet someone in person who knows me from Twitter or Facebook or my podcast or RNFM Radio or whatever, they say, "Oh, you're just like you are online." So I want my nurses, my clients, to have that same experience, not in terms of social media, but in terms of the person who they are, the heart and the soul and the passion and the excitement and the intellectual acumen that they bring to nursing. I want that to be able to be communicated to their patients if they work in a clinical setting. And with some clients, we do talk about the way they approach their work, and we talk about the way in which they approach their patients and their colleagues so that they can bring, the best term I can come up with really is authenticity. Authenticity, I think, is important to the work I do because I'm a public figure. And it's also important to nurses. If you're a different person outside of the hospital and you walk into your patient's room and you're robotic and task-oriented and not connecting and relating, there's something missing. And oftentimes it's not necessarily the nurse's quote-unquote fault. It's that the nurse has so many patients to care for, so many pressures coming onto her from other people and other powers that be, that she or he isn't actually able to be as present with the patient as even they would like. And their unhappiness leaks out in different ways. And of course, we don't want it to leak out to the patient, but patients can feel it because they're perceptive and they're in vulnerable positions when they're sick or disabled or just out of surgery or getting ready for surgery. So patients are in there because they're vulnerable and they want the nurses to meet them face to face. And I think that's one of our greatest goals when we're involved in direct patient care.
From a holistic standpoint, and you said this is the first thing, that the first approach, the natural approach, the human approach, it makes sense that a nurse who is happy and content with his or herself and his or her job and will provide that, it will be reflected in how they treat the patient. And the patient will reflect that in gratitude, for one. But where else do we see it, Keith? Let's hear it out. Let me ask it this. Okay. I'm going to lead you into this because I think that anyone who's listening knows where I'm going with this. Okay. So healthcare, and just for a background for patients, if you're a patient in a hospital, if you've been in a hospital, you know you get those surveys. So So the health systems they judge their behavior based on your feedback to them. But even more so is the actual outcomes, right? So again, if you listen to my shows, I'll dig a hole for myself. I'll start a question. And I'll answer it and I'll play around. What can you add to that? Because what I'm really trying to get at over here is that healthcare there's a lot of numbers, there's a lot of data, there are a lot of tools, there's ways of rating health systems. But what's the ultimate point of what we do as nurses?
The ultimate point, I feel, is increasing and empowering the health of our patients. So if a patient comes in the hospital and has surgery, that patient leaves having had a successful surgery, having been cared for in a very heartfelt, compassionate, authentic way. They leave educated about their condition or whatever it is they came in for. They understand their medications. They feel like the healthcare system has met them, that they've been met, and that they can leave there feeling secure that the healthcare system has their back. I feel like that's a really important mission of nurses who are working in the trenches, like you say on your show frequently, that's the really important thing. And on one of your episodes I was listening to, you had said that, here's a quote, "It's the first step to changing healthcare is refocusing on our purpose." And I loved that so much I wrote it down. And I'll probably post it on social media and credit you for it because I think it's really important. So if we can connect with our purpose as individuals, that's great. I also think that institutionally we need to reconnect with our purpose because I feel that often on certain levels there's a disconnect. So a hospital might have an awesome mission statement and a set of values on their website, but those need to actually be communicated and operationalized from the top to the bottom and from the bottom to the top. And if that doesn't happen within what I would say is the nervous system of a hospital, then something's wrong with the body and we need to fix that. Does that make sense?
That makes so much sense, Keith, that I have lost sleep over this issue. I have recognized this. I've spent a lot of time alone before I started this podcast. I needed to get this message out. It is so true, it is obvious, and it is most obvious to the patients. That's what I found in my own experience. So I'm glad that you mentioned that. Let me ask you this. How are healthcare systems receiving your message? Are they supportive of what you are trying to do?
Yes, I believe they are. I think some of these things are hard to put into place, to operationalize on a systemic level. I think it can be done and it is being done. Just recently, I was in Lincoln, California, right outside of Sacramento, and there was a big conference from Adventist Health. They're a health system in California, and I think they have some facilities outside of California as well. No, actually, I know they do. They flew nurses in from all over their health system, nurses who were chosen as leaders within their system. And the entire conference was focused on increasing the quality of care and the quality of the nurses' lives. It was pretty fantastic. And one of the talks that I gave was on mentoring in nursing, talking about how mentoring is really an important process that really should be taken seriously by hospitals to make sure their nurses have the support they need to really actualize themselves within the system. And the other talk I gave was on healthy work environments. One part of that talk was on the physical environment, how to make the physical environment more amenable for the staff so that the staff are healthier and can provide better care because they're not in pain, et cetera, et cetera. And the other bigger part was on the psycho-emotional and psycho-spiritual aspect of the workplace and how to improve it. So there are systems open to this, but I think healthcare, from my perspective, there's such a relatively small profit margin for some of the smaller hospitals. I think the resources to actually put these things into action are hard to make come to bear. It's hard to make them come to fruition. And that's where I see some of these systems. I think they truly authentically want to do these things, but they're not quite sure if they can manage it. And we need to find innovative ways for healthcare systems to create better environments for their staff, which also will then affect the patients.
I find that to be very interesting because I know that it's all, as mentioned earlier, it's all about data, right? How can you possibly prove that through a speech or a workshop, how can that be reflected in data? And which data? It's that loophole thing. It's like, is my stress causing me to get more sick? Well, I believe that it is. I believe that stress has an effect, but how can you prove it? I spoke with my cardiologist about that. I said, I think my heart valve has gotten worse, and that's another discussion. Well, look forward to that on my show later. I'm going to tell you all about my heart valve. But a lot of these intangibles, we as nursing thought leaders believe that, gosh, it's a simple solution, but we're often met with so much resistance on the organizational level.
That's very true. Healthcare, you said this in a recent episode I listened to of this show.
Oh my gosh, Keith, you're like one of my greatest fans. This is so cool.
Oh, it's great. Healthcare is a behemoth. You mentioned it's millions, billions, maybe trillions, and let's just say gazillions of dollars are floating around in the healthcare system. Where is all of that money being spent? And it's just like if you extrapolate that out to the government, and you look at the level of corruption or graft or whatever it is that's happening out there where money and resources are wasted or misappropriated. So if healthcare systems are finding it hard to do anything other than the basics, and they're not able to provide even coverage so that nurses can go to the bathroom and have lunch during the course of their shift so that they're healthier during their shift, then something needs to change. There has to be a shift, because if those gazillions of dollars are being moved around but in a way that's not really benefiting the people who are caring for the patients, then something's wrong.
Right. I'll tell you what, Keith, I'll bet you there's one or two healthcare CEOs listening to this show.
I hope so.
They should, because we're speaking the truth. And I really do believe, I really truly believe, Keith, that if you speak the truth and you're passionate about it and you're trying to do a good thing, it will win. It will ultimately fix things. It'll help. So I will tell you, my dear friend Keith, keep it strong. Keep on doing what you're doing. Keep on making those successes, encouraging people, helping nurses, encouraging them to help their patients. Keep that broader perspective. And that's kind of like my blessing to you. I really do appreciate what you're doing. I really appreciate talking with you, and I really hope to have you on this show more often.
Dove, I'll come on the show anytime. I accept the blessing from my new nurse brother rabbi. And as fellow Jewish man of Eastern European heritage, it's great to be here with someone who feels like a brother and a cousin. And, well, maybe we are related way back many generations. And what I want to tell your audience, the ones who are patients, is that you have a right to receive the health care that you deserve. And you have a right to question everything that happens when you're receiving health care, whether you're sitting in a doctor's office with a nurse practitioner, sitting with a surgeon, whatever it is that's happening, you have a right to question, you have a right to make demands, and you have the right to give feedback when things aren't quite up to par. So like Dove has said, like you've said on the show, patients are really what healthcare is all about. Without the patients, healthcare wouldn't exist. So that has to be our focus. And the patients who are listening to you are really blessed to have you out there as their champion and cajoling this whole system to change. And I'm happy to be part of it, even just for a few minutes.
Thank you, Keith. And Keith, one last thing. Why don't you tell us how we can find you and how we can get in touch with you?
Sure. The easiest way to find me is at nursekeith.com. You can find my podcast there. You can find my blog and information about me. I also recommend going to the Pulse Media Network, pulsemedianetwork.com. That's our new network of podcasts, and you'll find my show and some other shows there as well. So those are the two places I recommend most highly.
Thank you, Keith, and thank you so much for joining us.
Thanks for having me.